from doctors, allied professionals, support and administrative staff also carry out the day-to-day operations of a healthcare facility. Now, this staff is crucial. They cater to patients and their relatives with a wide range of services, from medical assessments, their daily treatment, to medication and catering. Their job responsibilities are multifold. That is, they're bridging the gap between the doctor, the patient, and the families. Unfortunately, even today, the non-medical staff is still struggling, getting discouraged, and having a low self-confidence because they haven't nurtured their people skills so that they can effectively interact with the patients, their families, and also amongst themselves. To discuss this, we have with us none other than Dr. Sangeeta Reddy, who's the Joint Managing Director of Apollo Hospitals. She's a member of the World Economic Forum. She has advocated and influenced policy decisions. She has even spoken at the World Health Congress. She's a firm believer in the potential of leveraging technology in the holistic manner. Dr. Sangeeta Reddy is focused on setting benchmarks in futuristic healthcare projects enabling IoT, AI, data analytics, drone research, blockchain. Apart from her role as the joint MD of Apollo Hospitals, she's also the chairperson of Apollo Knowledge Center and the head of Apollo Philanthropy. Welcome to Business World Healthcare, Dr. Sangeeta Reddy. So my first question to you, Dr. Sangeeta Reddy, is that do you think that the non-medical staff in the hospitals get their due credit for the work they do?
So I think overall as a sector or an industry, people are beginning to realize about the value of the support team. But let me, say that from the very beginning, Apollo has always had a commitment towards, the non-doctors. Our logo itself is a nurse. Our chairman has said that my maintenance engineer is as important as my cardiothoracic surgeon. And I actually coined the phraseology called the unsung heroes of medicine, because our housekeeping staff, they ensure infection control in their own way. Our food services team, our back-end staff, all of them are as critical in the overall delivery of results and good outcomes for patients. And therefore, the Apollo family, as we think of them, are a holistic, cohesive team working around the patient. But at the very, the opening, you said that thing of, do they get as much credit? And I believe as a sector, we have a lot more to do.
Ma'am, while a lot of focus has been on upskilling and training of medical professionals, there are a lot of these CME courses, there are a lot of training programs that get organized. Do the hospitals provide the same opportunities to the non-medical staff? And it's not just Apollo, but do you think that the industry is doing enough to upskill the non-medical staff in their infrastructure?
I think every intelligent, forward-looking hospital system is. And so whether it's, technology upgradation, we actually did a tie-up with NASSCOM. So NASSCOM is training almost 800 of our people in digital skills. So there's the cross-functional training, because, to do the same thing, whether it's a receptionist or a front office, to do the same thing for 30, 40 years, which is, what a career is unfair. So cross-functional training, so they learn new things, they move into new departments, they move up the career ladder. Healthcare for non-healthcare people is also a very important thing, because I think we bring in people from different sectors, but they need to understand, that if you're having a gastroscopy, you have to be on an empty stomach. And if someone has an MI, time is of the essence. So the aspects of learning of medicine and important elements of medical care and its role in the overall ability to fulfill your task. So healthcare for non-medical people, but then talent, people management, conflict resolution, handling difficult customers, empathy, sensitivity, listening skills. There's so many, and it's all part of our learning and L&D process. We almost 25 years ago put in the policy that we need to do a minimum of 52 training hours even for our non-medical people as well. Many of them do more than 50, and in fact, most of them do more than 50. But our L&D department is working on, technology. So we use from MedVarsity and MedSkills, we use sim labs. So in the simulation lab, people learn rather than having to learn in the, on a medical patient. We're also using cool tools like gamification. Our pharmacy team was the first one to do that. So because they distributed 4,500 pharmacies. So how do you get those, 5-10 staff in an isolated pharmacy? So the mobile phone and gamification is unifying the organization and teams who are not in the large main hospitals. So technology has helped us a lot in not just bringing together the organization, but delivering high quality, effective learning in a digital environment. So actually lots of work going on this.
I'm glad you brought up technology as one of the ways that you're using to impart training. But in your opinion, when you look at the upskilling of non-medical staff, what are the key areas that you think they need training in the most so that we can create efficiencies in the healthcare delivery? And also, does their work contribute towards the actual outcome of medical services?
So let me take the last one first. Undoubtedly, their role is significant in the outcome as well. It's not just in the overall experience. How well have you been received? How well were you directed? How efficiently is your medical process done? Is your paperwork right? Is it minimal, etc.? There's a lot of work. But like I was alluding to earlier, the support system is what enables the doctors and the medical teams to deliver that ultimate outcome. So if the maintenance team doesn't have the steam of the boiler working, how is your CSSD going to function? If your central sterilization department or CSSD is not functioning, how do you manage infection control? So not only their role is critical, what is critical for an organization is an appreciation that everybody has an important role. And so our quality teams, our JCI protocols, our monitoring of quality, the involvement of cross-functional teams in that, all go to highlight not just the role that they play, the important link that they are in the entire quality chain, and a patient's life may depend on it, but also everybody's appreciation of that, so that the respect system for every level of staff is high and is a culture of nurturing and training and evolving and learning. But in terms of what kind of skills they need, I think the first one is really the whole thing of patient centricity. Because very often staff get commands from or directions from, say, doctors or senior nurses or senior managers. So they begin to think that their job is to listen to those bosses. But in a hospital, the biggest learning is patient centricity, that the customer is the boss. And the so-called person who you thought is your boss is only a guide to enable you to serve that customer. So patient centricity is the biggest thing that we focus on. Besides that, digital skills is important, people management, conflict resolution, listening skills, situation handling, because you see all kinds of situations in a healthcare environment. The ability to pacify, a lady who's just found out that she has cancer. She may, hold her stiff upper lip in the doctor's office. She steps out and bursts out into tears. What should that receptionist do? How do you quickly find an empty room, pacify her, ask her if she wants to call a family member, give her a glass of water, check if she has transport, make somebody else cover your position because you're going to need to spend 15-20 minutes with this person. So it's a series of steps, and your brain has to think on those lines, and the system has to support you to do this kind of work. So, a birthday cake for someone's birthday when they're in the hospital, those are things that, you can put into the process. And we have done, and they are wow, delightful moments, and our team does them very sweetly. But they also do it with their heart. But it's situations like this We have a very, important and structured training program around management of after someone passes away. How do you prepare the body? How do you counsel and console the family? How do you hand over the body respectfully? Because, what we are now referring to as a body is actually their loved one. And that appreciation of, calling them by name, it is Mr. So-and-so or, Amma or whatever, but that ability to stay humane in these difficult situations is, I think, one of the important learning and skilling needs. And some people don't do it without training. For some, it comes naturally. And some need to be taught, not because they are not sensitive, but because they've not been exposed. And therefore, it is important for an organization to understand and to train people so that you are delivering these moments of comfort and, of course, of a wow experience.
Ma'am, you know what? I could actually sense that empathy in your voice. So I'm sure, Apollo is training. But what happens is that what I've seen when you look at, other than the large institutions, when you go to smaller places, standalone clinics, you always realize that for the patient, doctor is the last person they see, because they have to find a parking space, then it's a doorman, then the receptionist, then getting a pass, then meeting the doctor's assistant, and then they finally meet the doctor at the end. And by that time, they're either frustrated or they have created an opinion of the hospital in their mind already. So I'm glad you brought this up, because these are sensitive issues that need to be. But what is it that you do to share with them the importance of this? Because I see that a lot of hospitals, a lot of doctors, they tell their staff that, listen, I need you to smile. When a patient walks in, don't have a sullen face, right? But nobody's telling them why their role, what is the importance of their role. So how do you manage this at Apollo?
So this is exactly what you said. It's like Simon Sinek says, no, it's not what you do, it's why you do it.
Absolutely.
So when you tell them, so say in our call center,
yes,
we told the team, so day one, we told them, tell us someone who, you love the most and bring us a picture. And then they put it in their workstations. And then we tell them, imagine if that person was on the other end of the phone line. Talk to every call as if they were your family members. So it's some of these, and of course, that continuous sensitization, that the person who's coming to you and shouted because they didn't get a parking space, and it's not your fault, because, you are in reception and somebody or some security guard didn't handle parking, or the parking team didn't do it. How do you say it's my team? It's my organization. And more than that, this man is shouting in a situation he normally wouldn't have shouted, but he's shouting because he's worried if his child has cancer. So bring that sensitivity into every situation, and that honing of skills and a high degree of empathy is one of the most important things, which can only come by going on, talking, telling them, sharing stories, and celebrating when customers say they were good, and we pass that message back. Because I think the most powerful thing in the world is not, the motivator is, it's not money, it's not position, it's not power. It's that human touch and appreciation. Everybody wants to be appreciated. So across the board, we do, spot appreciation, we do group celebrations, we do awards for all kinds of quality related and human related initiatives. So we think that, this positive reinforcement of good behavior, of good practices, is one of the most important initiatives to supplement and complement a training program. So you put an entire training framework in place, you technologically enable it, you humanize it with stories and role play and incidents, and then you reinforce it through positive appreciation.
So, Dr. Sangeeta Reddy, my next question to you is about the initiatives that you are taking up at Apollo hospitals with regard to specifically training and upskilling to make a difference and create a differentiation for yourself?
Okay, so I guess I told you a little bit about it earlier, but let me, kind of start at the beginning. So one of the phraseologies, that we have for the Apollo family is that all of us are working towards giving TLC, which is tender loving care. And TLC seems like such a, kind of softish word, but we realized it's important to give tough doctors and, this thing kind of people, process people, or somebody who's pushing a trolley to say, look, we want TLC. How would you take care of a baby? How would you think about it like that? So staff are trained and guided to deliver that compassionate care, to go the extra mile. And we've encapsulated all this in the service philosophy for our hospital. So TLC is our service philosophy. Then we have critical standards critical to customer service standards guidelines. So, simple things like keep the place clean, but time, etc. And there are actually over 1,005 of these standards, which are given out to the appropriate. We're not going to dump one booklet of 1,000 on one person, but front office will get like 27 of them. And then the radiology technician, have you been sensitive about, someone has to change their clothes, where will they keep them, how will they hang it, how do they get it back? And all this kind of comes into the WOW experience tracker and monitor. Then we have in our quality guidelines, the Apollo look and feel, for which the individual who is in that workstation is responsible. So it's not only housekeeping. If something is messy, something falls, it's their responsibility to make sure it's this thing. We talk about, of course, protocols of facilities, maintenance, etc., so that the team on the ground, the front end team, know that they are backed up by many people who are working to enable them to deliver. And then there are multiple initiatives. So we did Dial 30. So there's a lot of operational research where we analyzed that a nurse is called 80% of the time for a non-nursing job. People press the nurse bell. So we introduced Dial 30, where Dial 30 is first this thing to say, how can we help you? And then if it's water, housekeeping, when is the doctor coming, and all these typical questions, it doesn't even hit the nurse. And if they say, we need a nurse, then she's told and she goes running. So things like that. We've also now put an app and an Alexa integrated room experience, which we're rolling out very shortly. So from the patient bed, they don't need to feel dependent on the attender who they have or on the nurse, because they can open their curtains, switch off the light, do all these things while they're on the bed. So we're realizing that people are getting more and need to be, in control. And this is one of those in control. So one patient once told us something very, interesting. He said the worst thing about coming to the hospital is not just the back end fear that something's going to be wrong with me or have a checkup, but I find myself quite helpless and at the hands of all these people. So this chairman of a board removes his tie, his jacket, his coat, his suit. He's lying there, chest bare. And one small technician who probably, is earning something that he would make in a few minutes. And that one, he's at the hands of that one who can poke and prod him and, put at this thing, the ultrasound. So it is that kind of vulnerability that we need to understand. The customers feel vulnerable. So building sensitivity around that. So have we covered them right? Have we told them what we're doing? The stepwise explanation of the procedure. If you say, and this you need to train people, I'm going to put ultrasound gel, which I need for the probe. It's going to be a little cold. Please don't mind. And then you squeeze. But otherwise, the doctors are just going to squeeze that gel and it's freezing. And so all these, can you minimize the negative reaction to essential medical protocols through communication is one of the underlying thought processes. So where we keep trying to build TLC moments through process and through insights from our many years of experience with patients. And of course, our biggest teachers are our patients. If you just listen, your customers will tell you the most.
Right. So I think my two takeaways from this answer of yours is that one, what I understand Apollo is doing is creating a mindset change in its employees, by bringing TLC as a part of their life and their communication. Second, what I understand is that you're taking away the fear which stems out of unpredictability by sharing with them what is going to happen. So there is no shocks and surprises. Is that correct?
Beautifully captured.
Thank you. Ma'am, my next question, since you brought up sensitivity, one is the patient centricity. But when you look at the atmosphere at the hospital, which is usually a stressed environment because people are dealing with a lot of sadness around and pain around, how can an institution like a hospital work on creating a culture where joy and happiness amongst its workforces can be created without actually creating a very dichotomy with the sensitivity with which they need to appear in front of their patients?
So this is a fantastic question. Let me begin by saying that TLC is not just for the customer. TLC is for our own Apollo family as well. So we need to treat them with respect and with care. So one of the things that over the last 3 years that we began doing, we were doing it earlier, but now it's become like a mandate, is that every employee and their wife, free of cost, will have a health checkup. Every day we are hearing, like day before yesterday, one of our managers came, ma'am, I have to tell you, my wife came in for the checkup. We expected nothing. We found a small lump in the breast. She had a lumpectomy. She's had 7 sessions of radiation. She's completely fine. We are so thankful that we caught it at stage 1. Every day, somebody has a stent, somebody has a... So the power of telling them that first we care for you, that's why we are forcing you to have this health checkup. So that's the physical well-being, but there's the emotional well-being as well, that we have a psychologist that they can call, because the stress of a healthcare environment is not easy. Then I spoke to you earlier about the structured programs of rewards, of incentives, of wow champions, anyone who delivers wow, the wow champions, superheroes at work, things like this is celebrated. Then we have a platform to showcase it, because like we said, recognition is very, very important. So physically and digitally, they get showcased. Founders Day is a huge celebration thing for us, because you get awards and people do like their best activity. It's the power of positive diversion. So we have song, dance, and it's unbelievable the kind of talent you have. So every unit builds, and then the best of that unit comes for the central program in Chennai for Founders Day. So this is one huge excitement. Then during the course of the year, this Rangoli contests and different things like that, cricket matches, sports. So you keep your team engaged as you would in as many positive things as possible, and build a sense of, besides pride and all, a sense of belonging, that this is my organization, this is my team, they're going to be there for me. I think is one of the critical aspects. And then you keep, it's not just, you keep displaying it in as many ways as you can.
Is there a fear of losing your workforce to the competitions once they are trained, and would it actually work as or would it work like a retention strategy?
I think, luckily our attrition, and we have attrition. So what we saw very early in the days, a lot of our attrition used to be to go abroad. And it used to bother us. And we had first our nursing director would say, keep their certificates back and things like that. And then, we kind of said that if you're losing them to something that you cannot deliver for them, then you should bless them and let them go. So nurses, went abroad. So if they're going at a much higher salary, if they're going for a higher position, so we lose doctors who are part of the team or a junior in the team, somebody else offers them head of department, they're going to go. You lose a nurse to the Middle East, going to get 5 times their salary. So we work towards keeping our attrition as low as possible, and we are among the lowest in the industry, whether it's across the board. And we will continue to do so, because there's a certain sense of belonging, of culture. Many of our not just our leaders, but many of our team members, they retire from it. 30 years, 40 years, their kids want to work at Apollo. So it's we have that fairly strong culture, and I'm very happy about it. But one of the things I will say, separate from this question, is that we as a country and as a sector need to figure out how we can pay healthcare workers more. The rates of CGHSR and the insurance reimbursement and the way people are, and now this new thing on GST, people are squeezing the healthcare sector, the margins are getting smaller, and we're not able to pay the way, other industries are paying. And therefore, I think the country must realize that healthcare is important, must enable higher prices so that we can pay our people even more. And this is something our chairman is also very passionate about. We think it's critical to do that. And there is a global workforce shortage. 17 million is the global workforce shortage. India is the place that every country is looking at to poach healthcare resources. So we better find a way to pay our people more and retain them. Otherwise, we ourselves will have a healthcare crisis.
During the pandemic, there was a lot of pressure on the healthcare infrastructure, and people who were in the front line were these doctors. And some of these doctors, they felt helpless. They knew what they could do. They knew that they could save lives. Or, people always looked at them that, I know this guy, so getting a bed in the hospital is not an issue. But all these challenges brought in a situation of helplessness among the healthcare providers. How did a hospital like Apollo handle the situation so that you could keep your doctors and staff and non-medicals mentally strong during that time?
So I think that it was a crazy time.
Yeah.
And the first is to put on the switch of, it's not about me, it's about saving the world. So when you stop thinking of your problems, then your orientation towards the community. And then we built a multi-sectorial initiative called Kavach. So first was the app. We've had over, I think, 21 million downloads of people who could do a risk score or get feedback or do their teleconsults. So doctors who felt isolated from their patients, all of them had the ability to video consult. So patient would call, they'd say, download the app, let me do a consult for you. I'm talking. So even those who were sitting at home were working with their patients. The second after Kavach was what we call the Red Book, which was the care protocol. We quickly figured out how many of our beds would be allocated for COVID. What is the treatment protocol in that? And the Red Book brought out the treatment protocol. So immunologist, infection control, cardiologist, pulmonologist, internal medicine all sat together and put that protocol out digitally. We sent it to everyone. In fact, we shared this with non-Apollo people as well. And then every time, because science was changing, so we were in touch with the international agencies and bodies. We were in touch with GAPIO, which is the Global Association of Physicians of Indian Origin, and kept updating the protocol based on new science as it emerged and shared the updated protocol. So no one was alone in the fight. Then we knew these beds are not enough. So we created the concept of Stay I, which was stay isolated. We converted almost, at one stage, we had 12,000 hotel beds converted into COVID-enabled treatment because you could video consult from the individual's phone. The central call center was handling it. We knew when a patient was very sick and we transported them into the hospital or the emergency room, and the system managed this. So you feel helpless when you know you can do stuff and there is no activity happening. When you channelize your capability to do as much as is possible, you know that every person you help is one step more towards saving the world. And that's the feeling we brought about in our team, that they know that the system was working to help them do the best possible. And at the same time, we took care of them. We took hotels and hostels to keep them in that safe environment so they didn't carry the infection home. so their families were protected. For families who had no methodology of food or care, we found ways to deliver food to their families while they were working in the hospital and staying isolated or living there. So they worked for X number of days and then went home for X number of days. That way we were able to match, especially for nursing, this was a critical one. Most nurses, of course, are in the hostel. So many steps. Housekeeping, we did a similar thing because we needed that backup team. So many of these steps became kind of the way that, and human resources, our HRD department just stepped in. Finance, became a super supportive function, not a control function anymore, because, chairman said, don't look at costs now. This is about saving lives. This is a time which will be written in the history of our organization of how we, just extended care. None of us, senior leadership, none of us put our phones off at any time because we were getting calls day in and day out. And, I'm really distinct to say that somehow, I don't know, it was probably God's grace and a lot of things, we did not turn away a patient for lack of oxygen, or did at least directly or indirectly some support for every patient. We networked with other hospitals. So we, had some solution. There was nowhere where we said, I'm so sorry, we can't help you. And that, I think, is a feeling we will always carry back, that God's grace and systems grace. And many people, they say we felt that confidence that Apollo is going to be there for us. It is a time that we will never forget. And, it's a once in a generation kind of a thing that happened. And I'm happy that we can sit back and say that, yes, we gave it our best shot.
Yes. And I think, one of the good things that happened as a learning, as an outcome of the situation that we went through and situation that all of us went through is, I think that the healthcare has got back that legacy of being a respectful profession. And it has triggered the kind of empathy among people who are the healthcare providers, right from the doctors to the housekeeping staff. I think that empathy got triggered in everybody's life. And thank you so much, ma'am, for taking our time to speak with us. It has been such a pleasure. I personally really enjoyed this conversation.
Thank you. It was good for me as well, because I really love human resources. I believe it's at the heart of everything we do in healthcare. And it's been, my privilege to work with the Apollo team. So, thank you.